Good morning from Chicago. Thank you for joining us at the first virtual event of the Pritzker Forum on Global Cities. Together, the Chicago Council on Global Affairs and the Financial Times have been hosting the Pritzker Forum every June since 2015. Our annual gathering brings together the world's leading experts on cities to explore their role in addressing the global challenges we all face. As we closed last year's event, no one could have predicted that 2020 would bring one of the greatest challenges our world and our cities have faced in recent times. The COVID pandemic has changed global cities as we know them. The resulting economic, social, and cultural transformations of our cities have been truly unprecedented. Cities are frontline actors, responding to a public health emergency, coordinating with state and national directives, and balancing shutdowns of core businesses, budget shortfalls, and social unrest. Like many of us, city halls around the globe had to do these things while finding creative ways to work remotely and stay connected, both with each other and with the world. When the Council's offices closed in mid-March, we made the hard decision to cancel all our in-person gatherings through the remainder of the year, including canceling the 2020 Forum. Our teams went back to the drawing board to redesign the Pritzker Forum on Global Cities as a year-round platform for conversations to help us make sense of what this pandemic has exposed and to elevate ideas for how we can recover and rebuild the cities that we love. Over the next 12 months, through live stream events, high-level workshops, and a variety of digital content, we will explore the new reality facing cities. We will focus on three areas: adapting governance, pursuing equity, and reimagining resilience. This virus has exposed strengths and weaknesses in the way countries, states, and cities prepare for health and pandemics. It has shown us in real terms how different levels of government work together, or not, in times of crises. It has also highlighted existing inequalities in our cities, which disproportionately affect the most vulnerable among us. Given the many challenges exposed by the pandemic, from shockingly imbalanced health outcomes to the expansive digital divide between communities, it is imperative that we build back better as global cities strive to come out of this pandemic both stronger and more resilient. Today, we will take a deep dive into governance at every level of leadership, from the global to the local. We will hear from speakers, including Helen, former Prime Minister of New Zealand and co-chair of the World Health Organization's independent panel on pandemic preparedness and response. We'll also hear from the President of the U.S. Chamber of Commerce, Suzanne Clark, and from mayors from Palermo, Dublin, Seattle, Pittsburgh, and Miami. Many of us have been home for over 6 months and have encountered some version of Zoom fatigue. So I'm especially thankful for you spending your time with us here today. Thank you for trusting us to unpack the most important issues of today, and above all, thank you for your support. And now it's my pleasure to welcome our co-host, the U.S. editor of the Financial Times, Peter Spiegel. Peter, we've greatly appreciated our collaboration over the years on global cities, and now also on the 2020 election with the Financial Times. Over to you, Peter.
Thank you, Ivo, and greetings from one great American city, New York, to another, Chicago. As much as I love New York, I just moved here a year ago. I must say, I wish I was in Chicago with you all today. I think these virtual events, in many ways, show that there are ways that they are better than the in-person events. We can connect experts on urban issues from around the world in a way we never could if we all had to hop a plane to O'Hare. But with these online events, which I participated in, have also taught me is there's no replacement for cocktails over the Chicago River or dinner with the world's leading mayors, or, and this is the thing I really miss, a double cheeseburger at Au Cheval in Fulton Market. Ideas that generate positive change really only find soil to germinate and grow through casual in-person discussions, I fear. So here's hoping that we're back together in the Windy City in a year's time. As Ivo just mentioned, the FT has co-sponsored every event that this event every year since we started 5 years ago. It has almost felt like every year was the perfect year to convene because there was a threat always being posed to global cities. The rise of populism that threatened that curtail immigration that has for centuries made cities vital melting pots. The siren song of protectionism threatened the international trade that has made cities hubs of innovation and growth since civilization first started at the confluence of the Tigris and Euphrates rivers. And political movements like Brexit and Trumpism threaten to turn public opinion against the very things cities hold dear: multiculturalism, elite education, high culture. But sitting here in Lower Manhattan, having traveled to the FT's American headquarters in a nearly empty subway, those things we worried about in previous Pritzker forums almost seem like minor distractions. People are leaving this island in droves. They are abandoning our cities. A story the FT has published this morning, timed to the start of this conference, uses data from Google and other sources to reveal that even as our societies safely reopen and carefully reopen, the city centers are not seeing the benefit. This is as true in New York as it is in San Francisco or London or Paris. Foot traffic is not returning the way it has in suburbs and exurbs. So we gather today at a time cities face a truly existential threat, a pandemic that has made density, commingling, critical mass, the very things that make cities great. Those things are now something that could genuinely kill us. Can cities recover? How can they improve their resilience? How can we draw our fellow citizens back to Midtown Manhattan or the Loop? These are urgent issues, and thanks to Evo and the Chicago Council, we have a well-established place to discuss them and hopefully find solutions. With that, back to you in Chicago, Evo.
Well, thank you, Peter. When the live was canceled, when our live event was canceled in June, our teams went to work reimagining the forum in a virtual setting and creating new digital content to help you understand the way local governments have responded to this crisis. Chicago's own Mayor, Lori Lightfoot, who was scheduled to open the in-person event last June, has been working to keep Chicago and its residents safe during these trying times. Unfortunately, the mayor was not able to join us live, but she recorded this video for us to share with all of you today.
Hello, everyone. This is Mayor Lori Lightfoot. Although the Pritzker Forum was canceled this year, we can still celebrate the importance of global cities and how they can take on global challenges, especially now during the COVID-19 challenge that we face. We are looking to each other all around the world for the best ideas, data, and strategies to confront this pandemic.
Great. Glad
Here
it worked
in Chicago,
out. See you guys later.
We are on the front lines doing everything in our power to provide testing, face coverings, food, resources, and more to our residents. And I feel extremely fortunate that Chicago has a place on the global stage, helping us to form connections and partnerships to better respond to COVID. It's a critical moment that global leaders do the right thing to set the precedent that making hard choices is sometimes necessary. Keeping people safe and healthy should be every leader's first priority. I'm honored to continue working with you, directly and indirectly, to defeat this virus and to take on whatever challenges we may face next. And I look forward to seeing you all again in 2021. Thank you, and be safe.
Thank you, Mayor Lightfoot. What an inspirational message here from our mayor in Chicago. We look forward to engaging this morning with our speakers and with you, our audience. We'd love to hear from you about your city's response to COVID-19 and how you feel about the future of cities. Please take a moment to visit ccga.live and take our live polls. We will share the answers that you generate at the end of the program. Also, don't forget to tweet us during the program. Before we continue, there are a few people and institutions I would like to thank because without their support, none of this would be possible. Of course, the Financial Times, our co-host and partner from the beginning in 2015. The Pritzker Family and Foundation for their namesake sustaining support. Our corporate sponsors, lead sponsors AbbVie and UL, supporting sponsors Kirkland Ellis and United Airlines. And the Robert McCormick Foundation for their support, not just for the forum, but for our year-round research on global cities. And of course, I want to thank the many international and civic partners who have signed on. the mayors and speakers who will be contributing their expertise and, importantly, their insight today and throughout the year. And again, thanks to all of you for taking time out of your busy schedule to join us today. And now I'm excited to introduce our first moderator, Leyla Boulton, Executive Editor and Editor of Special Reports for the Financial Times, for a conversation with European mayors on their experience responding to the ongoing COVID-19 crisis. Hi, Leyla. So glad to have you back with us again. You closed the last forum with a wonderful conversation on the role of cities achieving the global sustainable development goals. We're so glad to have you back, even if we can't do it all live here together in Chicago.
Thank you, Ivo. It's wonderful to be here with you all, albeit virtually, rather than one of my favorite cities. As Ivo said, I'm the editor of FT Special Reports, and my colleagues and I will be publishing next month's special report on the future of cities. With me to explore how to manage the competing priorities facing cities in the age of COVID are two very special European leaders, Mayor Orlando of Palermo and Dublin's Lord Mayor Chu. As here in the UK, we faced the first big clash between local and national leaders over new restrictions for hotspots in the north of England, in this case, Italy and Ireland appeared to have maintained a relatively cohesive stance on coronavirus. Mayor Orlando, you've compared coronavirus to the mafia. Tell us how this achieved a degree of unity on the pandemic, and what other measures did you take to reinforce this solidarity?
Thanks for your attention. I wish just to say that in Palermo we are accustomed to fight against the mafia, and we are ready to fight against the virus. Because I think that Palermo was able to fight and is able today to fight against the virus because has lived the terrible experience to try and finally to be free from the government of the mafia. We won and we wish to win another time because we have a vision. We think that we need to be free from the fear. And to be free from the fear, as Roosevelt said, we need to take care. We need to take care. And we take care of the human beings. Palermo has a vision. In Palermo, we respect the human rights because the lesson of the fight against the mafia was not only to say that we want to respect the law, but we want to respect the human rights. Therefore, when people ask to me how many migrants are in Palermo, I do not reply 80,000 or 90,000. I reply no one who lives in Palermo is Palermitan. I make no distinction between who was born in Palermo and who lives in Palermo. Therefore, Palermo is today exciting, safe, and not expensive. Exciting, because just like a rainbow of different colors, just living together. Safe. We are in Italy, criminally, the safest city. And we have been the safe city in fight against the virus. Among 107, just the city, being the capital of province, Palermo is the last. Less infected, less death. Because we demonstrated that we have discovered the fight the mafia, how important is the life. And we wish to go, of course, forward on this way. And the mayor has to be a local authority, but needs just to be a local authority in a world where we live in a global dimension. There is nothing so global like the virus. Imagine, the virus is more global than the Second World War. The other global activity in the world is digital. So the mayor has to be near to the people, to touch the people, but has just to use the digital system to let the people be a community. So I can say that I feel me just like a start-up of mayor. Imagine, the first time I was at the mayor for 1985, and in 2020, I feel a startup of mayor because after virus, we had to change our perception of the time, our perception of the space, our relations with economic activities, our contribution to economic development. We have to take care of the human rights just using digital, not letting the citizen be used by digital. It's just our position. So I can say that Palermo is a city that fight against the virus, as fight against the mafia, repeating I am a person that is against the individualities, and we are a community is against the closed groups of clans, of family, just closed and not having relation with the others. So I think that the virus is a dramatic but positive opportunity to change. We hope to be able to go outside from the tunnel better than before we came inside the tunnel. Palermo has become a touristic city, and we are seeing that our attraction for the tourists is strong. So we are attractive for the migrants because migrants know that coming in Palermo, they are respected as human beings. And the tourists know that arriving in Palermo, they are considered Palermitan. So I think that we have to preserve, taking care the city from the fear. We want to be free from the fear, as I said and as I repeat. And I think that is the role of the cities, because the city are something like an educational agency, because we need, of course, national level, we need, of course, the international level, but the daily life of the people pass through the words, the activities of the mayors. So I say welcome, and I send my greetings, my best wishes to my colleague just speaking from Dublin. Thanks a lot.
Thank you, Mayor Orlando. Lord Mayor Chu, as the first Lord Mayor of Chinese descent, you have also stressed the importance of inclusion of other. And how do you see your role as contributing to this inclusion in a time of isolation for many?
Well, firstly, thank you for having me, and thank you for the kind words, Mayor Orlando, and I wish yourself and your citizens well. In terms of inclusion and diversity, it's hard to push any policy or agenda through when you have such a challenge in terms of the pandemic and in terms of what everyone is going through, because it's tough. It's tough for all that's involved in it, and it's tough for those that are trying to steer a direction and steer policy as well. For my part, inclusion is vital, especially during pandemic, because you will notice that the pandemic takes no prisoners. It is very much, it doesn't discriminate against gender or culture, but what it does, however, is it will affect the marginalized more, because if you are if you are from a poorer background, or if you are from a migrant background, more than likely you are in environments that you can't socially distance in, and you are in working environments that you can't socially distance in, or can't adhere to restrictions as much in, and as such, you will have that transmission. And this is why inclusion is important, because I think the more diverse we are as a society and the more openly inclusive, what will happen is it becomes a fairer community. And across the board, then you have that sense of not only community, of taking care of each other, but you will also have that equality as well, that people won't be in environments that they are more likely to contract the virus. So the agenda for me is more important now than any other time of the inclusion and integration agenda. But also overall, my remit has changed massively. The role has gone from a ceremonial role to a very policy-driven role, to a very action objective-driven role, to Mayor Orlando's point. It's about the citizens and their buy-in and keeping everyone safe. And that's what we've been trying to do this year. In terms of championing diversity, I think the very fact that the good citizens and the councillors elected me was a good reflection of where we were heading in terms of diversity and having a more diverse space within politics in Ireland and in Dublin. But there's still a long way to go, Leyla. Like, we're at 21% in the council when it comes to female versus male. We're in 22% when it comes to the Dáil, which is the main ruling house. And then you have 30% in the Seanad, which is the lower house. So it's a massive imbalance there that we need to address.
Thank you so much. Mayor Orlando, how do you actually win the argument? Populism has been a very powerful force in Italian politics over the last few years. So what does it take to actually get people on your side? Is it a lot to do with material support for people in a pandemic, making sure that people really feel safe from a material point of view to start with?
What does mean populism? What is populism? I believe, I think that populism is no respect for the time. A populist has no respect for the time. A populist imagines that it's possible to change everything, to solve a problem as soon, without contrast, without problems. I'm not a populist. My culture is alternative populism. I think, I believe, I agree that the change, the real change, needs time. I have respect for the time. I respect for yesterday, for today, and for tomorrow. 40 years ago, when I started my experience from this room to let Palermo no longer to be governed by mafia boss, because in my chair 40 years ago, where normally as mayor, mafia boss, if I should have said I will let Palermo to be free from the government of the mafia in 3 months, I should be populist. We needed 40 years to be able to say clear that the mafia does govern the city of Palermo. So I think that in fight against the virus, we need to send a message of respect of the time. The people have to understand that it's not possible to solve the virus today, in one day, that we need time. It means that we need to respect the rules just to take care of the health, of our health, of our relatives, of the health of other citizens. And just for this reason, I say that the mayor is in some way something like an educational agency. And as the mayor of Dublin said, if I may, I should say that just Irish and Sicilian are united because we both love the life. We love the life. So I can say that people in Palermo respected my orders. It is my merit. Yes. No. It's the merit of the Prime Minister. No. It's the merit of citizens. They love the life, therefore they respected my orders. Because they sometimes don't respect my orders. But when we speak about the right to live, they were really, really respectful because we love the life. In other country, other people love the money, and they respect first the money, then the life. Other people respect other value, then the life. I am Sicilian, I'm Palermitan. I love the life, and the people loving the life respected my orders. I think the same is happening in your city that I love because I feel a little Irish. Thanks.
Thank you. Are you winning the argument, Lord Mayor Chu? Do you feel and what tactics are you deploying to win the argument when you're not winning it, you feel?
In terms of COVID or in general when it comes to a local government?
When it comes to understanding the other, when it comes to accepting science rather than promises?
Well, we are, and you can see it across the board when it comes to kind of the scientific facts of COVID in Ireland. That there are a minority, a focal minority that does not accept the science or the facts, or challenges it. But there are the majority that have been really good in trying to keep each other safe, in trying to build that community. And it's to Mayor Orlando's point of people respecting life and respecting that of people's lives and opinions, and keeping each other safe and loving life as well. By the way, Mayor Orlando, feel free to come over to Ireland and visit when hopefully we get through to the other end. So we can have a bigger chat or a longer chat about this and our share of love things. But in respect to science and respect to the pandemic and people and the challenges, the issue will always be that there will try to be a division. And we see this in various political spheres across the world. You see it in the US, you see it in UK, where there will be a very focal, usually the minority, that will shout very loud and challenge the facts and challenge the science, when really science is science. It's there, it's evidence-based. This is why whenever we have an argument, we say it must be an evidence-based argument, and we want to make sure that it is true information rather than disinformation that is pushed along, because we are at the stage now where people are so polar, or there are divisions and countries are so polarized because people don't take on the evidence-based arguments sometimes, and they go with the disinformation that is filtered out there in various platforms. And I think COVID is a great example, because at the beginning of this, of COVID, you will see that within Ireland, within Dublin, everyone was very united. Then it started in the last couple of months where there were trickles of, people challenging the evidence behind mask wearing, people challenging behind whether you should social distancing, and then actually coming out with remarks that COVID isn't anything to be worried about, and COVID is just another like a flu, and it was all made up. But then how do we expect people not to be like that when we have one of the world leaders on a platform shouting that way? When you have people behaving that way and pushing out disinformation like that, then other people will follow. And that is something we need to look at, and we need to challenge, and we need to say, when does this disinformation stop? When are we going to start basing our arguments based on facts and evidence?
Thank you. One final point I'd like to ask both of you about. What lessons have you learned when it comes to the division of powers between central government and local government? Mayor Orlando, quickly with you, please.
Is that I believe that the local authority has to play its own role. I am not Prime Minister. I'm the mayor of the city. So I am more free on defending the rights of my citizen. I do not produce currency. I have no army. So my duty is to respect the daily life of the people, to respect human rights. Therefore, what I said is not only moral, it's not only legal, it's convenient, it's even economically convenient, because the cultural change of Palermo is that we understood that respect the human rights is convenient. It's convenient. There is no city in Europe so culturally changed like Palermo in the last 40 years. Not Berlin changed, Moscow changed, but changed in connection with international changes. We changed without changing constitution. We understood clearly that what we need is to respect the human rights. So, to respect human rights, we need to prevent. So I just signed an order, just prohibiting in the city of Palermo after 9 o'clock to sell alcohol. And I'm sorry for the Irish beer, I'm sorry for the Sicilian wine, but I love the life and I prevent the risk to die for my citizen.
I'll drink to that. Lord Mayor Chu, What are your thoughts? What would you like more power? Have you had, are you getting more power with the redesign of your role? Or
I
have you
think
got
there's a
just about
shift
enough?
in power. There's definitely been a shift in power. I would like to see this role have more power, and this comes down to local government reform. And this is why we need a directly elected mayor within the city of Dublin. And it's a challenge that I will be bringing to national government with the other mayors as well. And the other thing is, I think we look at local government reform and the powers within council level. Your council right now are the ones who are serving the people of their ward, or the citizens of their constituencies. And there's 950 councillors around Ireland. And right now, there's a distinct disconnect. They're the ones that on the front line, and national government are the ones making the overall national decision. And there needs to be more power given to the local councillors, because we can see it with the pandemic. When it came down to it, it was the ones on the front line, like all frontline workers, were the ones who put in the work and were the ones who had to keep their community and people safe. And not saying national government did not do their job, they did. And you can see it in the recent budget in how much they put towards funding. But overall, there needs to be a more balance of power between local and national government.
Thank you so much both for a terrific conversation. Unfortunately, we're out of time, but I would like to hand over to Ivo and have a good trip to Dublin. Mayor Orlando.
Thanks
Not
a lot.
now, not right now.
Come in Palermo and see how fantastic is my city. I am proud of the city that I love. Come, please.
Good. Thank you both.
Thank you both, folks. And when we are through this, hopefully in months to come, do come back, do come over to Ireland. Thank you, everyone.
Thank you.
Irish beer and Sicilian wine, okay? Fine.
Over to you, Ivo. Thank you. Bye-bye.
Well, thank you, Leyla. Great conversation, and I think we all would love to go to Palermo and Dublin. Thanks to Mayor Chu and Orlando for sharing how Europe is responding to the virus. Now, of course, with cases rising in Europe again in many countries and restrictions once again being announced in the continent, it is very important for us to understand what we may be in store as we return to school and face cooler temperatures in the Northern Hemisphere. Share your thoughts as COVID progresses by engaging with us on Twitter at the @_globalcities and with the hashtag @globalcities. For the next segment, we will explore how different levels of leadership have tackled the pandemic from a global, a national, and a local perspective. Now to Jamil Anderlini, Asia editor of the Financial Times, for our Keynote feature with Helen Clark.
Thank you, Ivo. I'm here with Helen Clark, the former Prime Minister of New Zealand. Madam Prime Minister, thank you so much for joining us. It's wonderful to see you. I think you're in Auckland right now, and in New Zealand, where once again the country has basically eradicated COVID-19. It seems the current Prime Minister claimed victory again in the last few days, or the last week or so. We've now got more than 35 million cases around the world. More than 1 million people have died from COVID-19. It's really been something none of us have seen in our lifetimes. When you look around at the global response to COVID-19, are there any patterns that you see that you would sort of highlight as real success stories? Apart from New Zealand, maybe?
Well, we're proud of what we've achieved in New Zealand. And of course, we're helped by geography. We have a rather large moat around our set of islands, but also our government has made sensible decisions. The decision has been to go for an elimination strategy, and that means zero tolerance. Where you see it, you stamp it out. We've just, in effect, stamped out another little outbreak that got into the community. But I think the success factors relate to, firstly, governments following good scientific advice, putting strong public health measures in place, and engaging with the public in an open and transparent manner, making all the information available so the public will come with you on the journey. Because in the end, this pandemic is going to end when we stop transmission, and we stop transmission when we as members of the public stop being willing hosts for the virus. In New Zealand and in those Scandinavian countries which have done well, and in Taiwan and Germany, the public has by and large gone along with what it's been asked to do. But that's no accident. It's because there's been trust in government trying to do the right thing.
I'm interested, how has the response of cities contributed to some of these successes? I mean, are they, are city leaders involved in some of the responses, or are they mostly limited to sort of executing national directives in your experience?
So different countries have different levels of responsibility lying with the subnational level of government, whether that's a kind of semi-autonomous region like Scotland or a big city like Chicago. In New Zealand, our government is quite centralised, so local governments have more residual powers, if you like, but the tone set by civic leadership in such circumstances is incredibly important, because if they try to fight the government trying to do the right thing, that ends up sending very mixed signals to the citizens. I think around the world we've seen a mix of experiences. For example, if you look at Spain over the last week or two, there's been tremendous debate going on between the government of Madrid, which is controlled by one party, and the central government of Spain, which is controlled by another, and they haven't agreed on the measures. And so when you have these complicated systems of layered government with different powers perhaps competing against each other, that can be counterproductive with a good response.
And have we seen the opposite, where maybe at the federal level or the national level, we haven't seen an adequate response, but we've seen cities perhaps that have done a better job? Can you think of examples?
Absolutely. Well, absolutely, and of course, I'm very conscious that we're speaking to the Chicago Council on Global Affairs, and so from afar we watch the course of the federal administration and its officials, and Dr. Anthony Fauci is a fine man, and he's done his best to lead a good response. But of course, the messages have been a bit confusing from the centre from time to time, whereas we've seen big cities like New York step up and do what they could do within their area of responsibility. A state like New York step up and do what it could, but I hesitate to go further than that, because I'm very conscious that in a country like New Zealand with rather centralised national government, it's a lot easier than when you have powers lying with cities, states, federal government. There's many a cup, the slip twixt the cup and the lip in such circumstances.
So in July, the World Health Organization launched the Independent Panel for Pandemic Preparedness, which is a bit of a tongue twister, and response. And you were appointed the co-chair of that panel, which is wonderful. Congratulations. For the Pritzker Forum attendees who are joining this, can you tell us a little bit about the panel, your responsibilities, and what you're hoping will come out of this initiative?
The World Health Assembly meets in May each year. It met virtually, and it resolved that there should be an independent, impartial and comprehensive review of the internationally coordinated response to the pandemic by WHO. So that's a mouthful. So what does that mean? What we have done is develop terms of reference which focus us on what happened and when, what then did WHO do, how were its messages received, and what could have been done better. I think we all feel instinctively the world could have done better. Look at this runaway pandemic with the 35 million cases and more than 1 million deaths. We're in the 21st century. We could have done better. So what let us down? We see ourselves as a panel which will be truth-telling, but not blame-casting. No point casting blame. We want to know what could be done better, but we have to find out the facts from which to then base sensible recommendations for change.
And is there a role, do you think, I mean, we're in the early stages, I know, but of this initiative, but is there a role for cities? I mean, do you think that, you'll be drilling down to that level? Like, what was the response in Wuhan, or what was the response in New York City, or in Milan? I mean, is that going to be part of the discussion and looking at that very local level response?
That's highly material, and we are making a call for submissions. We want to hear what worked and what didn't from the perspectives of the whole range of stakeholders. Cities are enormous stakeholders. I mean, no city wants to go into a lockdown that's in effect stops its economic activity except for essential services. So we all need to learn from what went well in some places and what didn't go so well in others. So we last night or night before briefed the member states at the executive board of WHO. We announced then that we are calling for submissions, and if people follow our website, yes, please tell us, please step forward. And if there's appetite perhaps for a specific consultation with key civic leaders from around the world, we'd be very happy to hear from them.
And, some of the places that have done the best are smaller countries or smaller, regions. In this part of the world, Hong Kong initially did well, Singapore initially did well, and they've not done as well as we go along. Taiwan has done incredibly well and still continues to do very well. Do you think that, larger countries, Western countries in particular, are going to learn from some of these smaller places? Do you think that's feasible in our current global environment, and you think it's likely?
I think there needs to be some humility here, because some of the most effective responses have not come from the greatest, most powerful and wealthiest countries in the world. They've come from the smaller countries, not least my own, but go to the Latin American continent. Uruguay has done well. There's a raging pandemic in Brazil and in Argentina to its south, but Uruguay has done well. How long it can keep doing well with the pressures either side, of course, is an issue, because we're in this for rather a while to come yet. Germany, as a large country, did well. It really stands out to me for having been very effective from the outset. But by and large, there's quite a lot to learn from the smaller countries, which took this very seriously, had committed leaders who listened to advice, engaged the publics, and got good results.
Again, it's very early stage, but if you're thinking specifically cities, are there any takeaways that you've managed to sort of arrive at already, where you'd say this is something that cities, I guess particularly in the United States, should do in the future? We expect there to be more and more of these global pandemics in the future, given populations and urbanization rates and things. So are there any sort of early learnings, if you like, from your work so far?
Well, a couple of points, I think. Clearly, countries need national pandemic plans which are flexible. A lot of countries had plans, but they were focused on a flu pandemic. This is not a flu. But below the level of the country, how many cities have a pandemic preparedness plan? I'd be starting to think at that level of what cities could strategize on and be ready for, rather than wait for central government to map out a path. Cities can also be masters and mistresses of their own destiny. The second point I would make to cities is that because of the economic damage of lockdowns, clearly some have been reluctant to go down that path. But everything we see about this pandemic is that the longer effective public health measures are delayed, the deeper and more protracted the economic damage will be. So I think a key learning is don't wait. If you start to see that escalating reproduction rate, jump on it, stamp on it, put the measures in place, and don't waste the period when you have some degree of lockdown. Use that period to put effective measures in place so that next time you get an outbreak, it can be contained more effectively. I think we're going to learn a lot from the deployment of Bluetooth technology to support contact tracing. We can be much more targeted. So there are key learnings, and I hope that our panel can contribute to more of them. being public.
Well, thank you so much, Madam Prime Minister. It was really insightful, and thank you so much for joining the forum, and hope to see you in Auckland sometime soon.
Well, thank you, Jamil and Helen, for this really important discussion, and Helen Clark already putting on the table how cities can better prepare for the future. So important that we think about how to do that. Unfortunately, Deputy Secretary of Health and Human Services Eric Hargan had a last-minute schedule change and therefore will not be able to join us today. But while we'll miss his perspective on the U.S. national response to COVID-19, we appreciate the work his organization is doing to ensure the health of every American and overseeing virtually every national level health organization that has been involved in responding, including, of course, the CDC, the FDA, and the NIH. The U.S. has seen almost 8 million confirmed cases of COVID-19 and now over 215,000 deaths. The economy effectively shut down from mid-March through June, with the Stanford study finding that the number of active businesses was down by 15% from February to April. For a look at the U.S. national response from an economic perspective, we're joined by Suzanne Clark, President of the U.S. Chamber of Commerce. Welcome, Suzanne.
Thank you so much for having me.
Suzanne, you run the world's largest business organization focused on advocating for pro-business policies across regulations, trade, workforce development, and so much more. Tell us, what has been the perspective from the Chamber on how the economy has responded to this crisis?
Well, first, good morning to all of the leaders that are attending this forum. I think it's a really important event, and thank you, Ivo, and everybody at the Pritzker Forum on Global Cities for hosting us and for including the U.S. Chamber. We really appreciate that. You know, we, as the former Prime Minister was just saying, we all know that this pandemic isn't just about physical health. It's also about economic health and the health in the communities in which we all live and in which we all serve. And it's why it's so important that events like this gather leaders from the public and private sector together at every level, both to restore our nation's health, to revitalize the economy, and of course, to help people rebuild their lives. It's unprecedented, right? I mean, even Saturday Night Live is making spoofs about 2020, but it's true. There's been no playbook for this kind of health crisis, economic crisis, all playing out at the same time. And we've watched leaders, both in business and in government, have to make super consequential decisions with incomplete information, with evolving information, with imperfect information, conflicting information. But now that we're 7 months into this pandemic, there are a few things that we know are true. One, we know that businesses are resilient. You know, we're lucky at the U.S. Chamber. We have a very unique vantage point in representing businesses in every geography, in every sector, in every community, in every size. And from the shops on Main Street in all of your cities that had to try to transform from bricks and mortar to digital work in days, to the big pharmaceutical companies that are working around the clock to develop the treatments and the cures and simultaneously preparing to deliver them to all of your communities, we've really watched businesses, everything in between, the big companies, the Main Street companies, really working to keep people on their payrolls, to serve their customers, and to continue to innovate to fight both of these crises at the same time. The second, and we just heard a little bit of this from the former Prime Minister, I think, the second is that we know that clear and consistent national guidelines from the CDC, from HHS, from FDA, et cetera, are really important for driving the kind of clarity and consistency that businesses need, and also that consumers need to have confidence to get back out there and get the economy going again. But that national guidance is best implemented on the ground. Local leaders know what's happening in their community faster and can respond faster than the national government can possibly do. And the third thing we know is that that's really important if we're going to avoid another shutdown. You know, when all of this started, extreme measures were really important because we didn't know enough about this virus. But 7 months in, we do know more, and it lets us hope and plan that we wouldn't need another blunt instrument of shutdowns if we got to a bad place in the pandemic again, because we now know masks work. testing is essential, tracing is important. We know social distancing makes a difference. We know being outside makes a difference. We know that flu shots are important. So it's really important that we view these measures not just as obstacles to daily life in terms of social distancing and being outside, et cetera, but as avenues to get us back to some semblance of normal. We know that these are a necessary reality until we get to a point of more therapeutics and, of course, a working vaccine. You asked about the economy, and we've been talking a lot about at the Chamber, as I'm sure all of you are in communities across the country, about how uneven this recovery is. We see some businesses and industries really thriving, while others are still just in free fall. We're seeing it in the job market. According to the BLS, there are 16 industries that still have job losses exceeding 20%, and 16 industries that are reporting job gains. We see it in consumer spending. More than a quarter of consumers are saying they're paying down debt faster than they anticipated, and we have a quarter of consumers saying that they can't pay their bills. So this K-shaped recovery that we talk about is really seeing some industries thriving and some in free fall, but even within industries, we see that problem. Some segments of retail are doing really well and some are still really struggling. And you all know in your cities that it's a real problem. We see, for example, in New York, the financial services sector rebounding super strongly at the same time that entertainment and hospitality and other industries are struggling really significantly, and we know it'll take them longer to recover. So nobody should really rest easy, even if they're on the side of a healthier recovery, because of the ecosystem our economy is. If broad swaths of our economy are still at risk of being left behind, the whole system is at risk. It's why the Chamber has been hyper-focused on continuing to advocate for additional targeted pandemic relief for those it will take longer to recover, and a really robust agenda to drive economic growth. We know what that means in legal reform, in smart regulations and taxation, in infrastructure, in trade, and immigration, and those policies become more important than ever. The problem, of course, is that these days in Washington, it's easier said than done. This gridlock that has been gripping the Capitol is unthinkable for executives and government leaders who have to run cities or companies and get things done. And it's really unacceptable when you think about how many communities, families, workers, industries are still really struggling to make it through these significant challenges. So I just want to close by enlisting your help, especially those of you who are public or private sector leaders in cities and communities. Our nation has a lot of work to do to get through this pandemic and to be stronger on the other side, and it can't be done without your leadership. At the Chamber, we know that energy and ideas and influence really come from the local level. It's reflected in our founding. More than 100 years ago, state and local chambers came together to begin and start and form the U.S. Chamber of Commerce. It's in our DNA from the very beginning. We work closely with our chamber partners in all of the communities to give American business a unified voice here in Washington. All of you on the front lines of this economy know what your cities and your communities need. You know the challenges and the opportunities better than anyone. And most of all, you know what a job means to your community. You know that it means health and security and opportunity and a future. And so we would just invite you to work closely with us and with your state and local chamber partners to push Washington for smart action so that we can help lead this recovery from the ground up. So thank you again for having me, and I'd be happy to take any questions.
Well, thank you, Suzanne. That's a wonderful overview. Small business is the backbone of much of the U.S. economy. And can you talk a little bit about how the Chamber is helping these small businesses to both endure the time that we're living through this pandemic and then, importantly, how to recover?
It's a smart question, and I think an important question for all of us. It started with the ideas of the PPP loans and the Main Street Lending Program. We then worked with SBA and Treasury after we were able to get them passed to make sure that businesses could access those resources as quickly as possible. We also pushed very hard for the PPP replenishment. And really, it took getting information into the hands of small businesses. So we've had a COVID relief and pandemic relief website that's been viewed 12 million times. The guidebooks have been downloaded 3.5 million times. The businesses have been really thirsty for information about how to get to the other side. And some of it has just been listening to them. Just this week, we've had 2,500 small businesses from across the country gathered in small breakout rooms to help give us advice about what large companies can do to help them in terms of the supply chain, what local and city and state leaders can do to help them, and of course, what they need the federal government to do to act.
So important for all of us to work together, both government and the private sector, and of course, big business and small business working together. It's all one economy that we need to do.
Absolutely.
Since the start of the pandemic, you've led the Path Forward program, a series of really insightful conversations with some of the smartest people in the world on the path forward from the crisis. Tell us a little bit who's been the most interesting about the people you've talked about, and what kind of ideas have come forward out of those discussions?
It's been so interesting, and it's just, I'm so blessed to have this job and get to talk to so many smart people all the time. I think one of my favorites was, of course, Dr. Fauci, not just because he's the expert we've all come to know and appreciate, but also because he had a great tagline. He said, we will get out of this, the pandemic will end, and science will lead the way, but it's going to take business to get us there. And it was a wonderful reflection of the partnerships, the public-private partnerships that have had to happen to get us through. We talked to Bill and Melinda Gates, who were really interesting in reminding us about the global pandemic, and it won't really be over until it's over globally. And most recently, we've been talking to a lot of people about vaccines. And, we were on the phone or on the program with Pfizer this week, who really believed that they could be vaccinating 10 million people by the end of the year, and really discussed why the efficacy and safety of the vaccine development process has been, yes, at warp speed, as they say, but not because they're cutting any corners, really because this is an unprecedented collaboration with FDA, because they're allowed to do a lot of things at the same time, and because they've been smart, they and other companies, to ramp up manufacturing and the supply chain, which will be so important in the distribution of the vaccine at the same time. So I think we all left that program much more optimistic about the efficacy and speed of a coming vaccine.
So let me ask you about the vaccine, because I think that is, and Bill and Melinda Gates have made the argument that no one is safe until everyone is safe, and that's the big question is not only will we have a vaccine, which is scientifically efficacious and of course safe, but how do you distribute that, and are you spending time with the businesses, because ultimately it's going to be business, particularly in the United States, but frankly abroad too. It's not a government responsibility. They need to help, but how businesses are going to make sure that everyone will get the vaccine, and what responsibility will business have to convince people to take the vaccine, which is another issue that is so important, of course.
Oh my gosh, you've hit so many important things at once. Starting with the last thing you raised about the importance of taking the vaccine, I think we all have a responsibility as community leaders to be out talking to our family, to our friends, to our businesses, to our network about this process, about, yes, it's been fast, but no corners have been cut, why it's safe. We've heard a lot of experts say it's really important to get your flu shot this year, not only so hospitals aren't overwhelmed, not only so that a doctor trying to understand if you're ill with COVID can rule out the flu, but also just to get back into the habit and get more people in the habit of getting vaccinated, that in itself will help get more people vaccinated or ready to be vaccinated for COVID-19. The second thing you asked about was the distribution. And I think these are really important decisions, right? Who gets vaccinated first? Why is that? How do we determine both frontline healthcare workers, the elderly, people who are the most at risk? How do we take care of our most vulnerable first? Those decisions are going to be really important. And I think the business community's role in the supply chain, they're doing a lot right now to make sure they have enough glass, that they have enough stoppers, that they're thinking about how important this global supply chain is in this moment to make sure that we have all the materials we need to transport. I mean, think about this, you have to transport it at a certain temperature. You're going to try to vaccinate 7.5 billion people. I mean, it's a mammoth undertaking that we can do, but to your really good point, only if we do it together.
Thank you again, Suzanne, for laying out the national response in the United States and, of course, the contribution the private sector is making. It's wonderful to have you here. Thank you so much.
Thank you for having me.
Now, before we move to our final segment, don't forget to take our live poll at ccga.live. Mayors have had to make unprecedented decisions and work with state and national officials to protect the health and safety of their residents. They've done this while facing massive budget shortfalls and transitioning their own offices to working remotely. To expertly moderate this panel, we have Financial Times U.S. Editor-at-Large Gillian Tett. Gillian, it's great to have you at the forum again, and for the first time doing this virtually.
Thank you very much indeed. It's great to be here. And having been introduced as an expert moderator, I can only disappoint and go downhill, I think. But anyway, great to be here. And we have a truly fantastic trio of mayors who are going to be talking about what's been happening on the ground in their cities in practical terms as they've been battling not just COVID, but the economic pain and the many policy challenges which have befallen them, and what that suggests about where America is going in terms of the relationship between municipalities and the federal and state structures. So we have Jenny Durkan, who is the mayor of Seattle. We've got Bill Peduto, who's mayor of Pittsburgh, and Francis Suarez, who's mayor of Miami. So we're covering America, both the warm and the cold and the, well, somewhere in the middle. But anyway, I'd like to start perhaps with you, Mayor Suarez, because we actually spoke a few months ago, because back then you were in this awful distinction, I think, of being the only mayor who'd actually had COVID. Is that correct?
That's right. I was the first. That's right.
Right.
Absolutely
well,
right.
Tell us a bit about what you've been doing on the ground and how your own experience of having had COVID, influenced your policy making, and maybe you can give some tips for the president, since he is also now in that position.
Well, thank you. It's an honor to be invited to this prestigious panel with two good friends who are mayors of two great cities in America. First, I think I was not only the first elected official or the first mayor in the United States that had COVID. I was only the second person in Miami-Dade County, in my entire county of 3 million people, that got COVID. So one of the things I realized right away was that you could be asymptomatic and be a carrier and potentially a spreader. And so I quarantined right away before I even knew I was positive. Just because I knew that I had been in close contact with someone, I quarantined. That quarantine lasted 18 days. I tested throughout the quarantine period, and it wasn't until I tested negative twice in a 24-hour period on day number 17 and on day number 18 that I felt it was safe, and that the medical experts that I was consulting with felt that it was safe for me to be out in public. So, for me, I think the first thing that I would say as maybe advice to the president is, I certainly I was at a much smaller scale. People are paying attention, and they're paying attention to every single detail. And, there's a tremendous amount of fear because of the fact that this is a highly infectious and deadly disease. And so it's imperative that you be transparent, and that, that people know exactly where you stand medically, so that they can feel comfortable, and so that they know that being around you is something that can be done safely. I also realized after 17 or 18 days the difficulty that people would have in quarantining. I had to struggle as mayor to figure out where I was going to quarantine. I actually quarantined at my house. My wife had to stay with my in-laws. So I was very fortunate that they had the ability to do that. So I pushed very early on for there to be hotel beds available for people to be able to quarantine, because I knew that if you were a family of five living in a one-bedroom apartment or even a two-bedroom apartment, if one person got sick, unless they were able to quarantine that person, the entire family was going to get sick. And we saw that phenomenon occur during the first spike in June.
Right. So, in terms of sort of what you have rolled out locally, and I'm going to turn to the other two mayors, in terms of what you've rolled out locally, I mean, how have you tried to tackle it on a local level, given your, shortage of resources?
The first thing that we did was we implemented a mask in public rule, and we find it people who didn't use the mask. We found that there was a very high utilization rate. We got about 80 to 90% of people using the masks, and we reduced the incidence of COVID in our community from about 3,500 a day at its high point in the county to now we're in the 400 range, so about 85% reduction just by using a mask in public. So that's another thing that's been a little bit of a frustration for me, is not seeing other elected officials at state level and federally implement a solution that's so easy, and that, by the way, is the only solution that you can implement that doesn't harm the economy. And it's been frustrating. I've called for a statewide and national mask in public rule. Unfortunately, that hasn't happened, and I think we've had more cases as a result.
Well, it's interesting because mask wearing is something that states can do. As you say, it doesn't cost a lot, but it does look from the data as if it's surprisingly effective. And it's a very powerful cultural symbol in some ways, both on the individual level, that it reminds the wearer that they have to modify their behavior at all times, but also it's a symbol for local initiatives, if you like. Bill, I could see you nodding while Mayor Suarez spoke. Have you done that as well in Pittsburgh?
We have not. And in fact, it's sort of a different story in Pittsburgh. Our local government does not oversee health. That's done at a county level and at the state level. However, we are on the front line when it comes to the challenges that have been created through this pandemic. So our public safety services were forefront going back all the way into January. Our concern back in January, and this was through consultation with the CDC, was when the pandemic hits the United States, what is the likelihood that it could spread through a police zone, a fire station, a medic station, and having to take that entire station offline? What types of contingency planning were we being made available, all the way to having 40% of our public safety crews under a certain type of quarantine. So we began planning for that rapidly in February and implementing it in March. Because we were at the early part of it, we were able to purchase our PPE at a time when there wasn't that great of a demand. So we were pretty good. But there were challenges that we weren't prepared for, or at least hadn't thought of. One of the most immediate was how to convert our Parks and Recreation Department into a supplier of food. We have some after-school programs, we have lunches for seniors, but between March and today, we have provided over 250,000 meals, and we didn't have any operation experience in that. So we were able to prepare a little bit earlier than others. We were able to work with our hospitals, but at that same time, we faced what other cities faced, which is an expansion of our duties, responsibilities, without the authority, but the immediate need to take care of people.
Right. Now, I know that Pittsburgh has been building quite a striking niche in healthcare in recent years. Can you tell us a bit about how that's helped you devise policy on the ground? And then I want to ask the same about Seattle, which I know has been doing a very interesting partnership with the University of Washington. But tell us a bit about how Pittsburgh's been trying to deal with the health issues, even though you don't have direct control of health policy, unlike Miami.
You're right. So what we do have control of is, like I said, is public safety. And we had H1N1 and Ebola protocols, which were in writing to be able to deal with potential outbreaks at those points. But what we were able to do was to work with two different hospital networks, Allegheny Health Network and UPMC, in order to be able to up our game, to be able to expand the operational side of public safety all the way from the very moment that any public safety official were to walk into any home, knowing or unknowingly, with a person who may test positive for COVID, all the way through the delivery of service to the individual within the hospital system. At no time during these past several months have our hospital systems become strained. But even though they weren't strained, we were still working with the U.S. Army Corps of Engineers to convert our convention center into a makeshift hospital if needed. And those plans are now part of our operational plans. And what's interesting about it is we go through this pandemic, we're building out a resiliency strategy that could apply to a flood. It could apply to a heat wave. It could apply to man-made disaster, just as it is applying right now to COVID-19.
Right, that's fascinating. Well, I want to pick this up in a moment about how these lessons are shaping preparation for the future in terms of municipalities and their interaction with federal government. But first, I'd love to get a view from Mayor Dirk and Jenny about Seattle, because, I mean, Seattle has got both this extraordinary pool of tech know-how, but also medical know-how at the University of Washington. How have you been trying to pull that together to inform your local response?
Jillian, great to see you and great to be here with our fellow mayors. You know, this has been the most challenging time, I think, for mayors across America. We are the front lines, and we were the first to see COVID in the Seattle area. And when we discovered that we had in the community, we had no federal leadership. They had missed it on the testing. And fortunately, we were a place that had a lot of world-renowned scientists and a great tech company. We moved immediately, creating our own playbook, trying to get people to work from home. And that showed that we were able to flatten that virus really quickly by having such a quick response from our employers and the city. But then we needed to employ a whole other series of measures because suddenly we had no playbook for all the ramifications, the health ramifications and the economic ramifications. So we had to change city government to be able to provide first frontline economic assistance to workers and to small businesses. I entered one of the first orders to stop evictions of residents and small businesses and nonprofits in Seattle so we wouldn't have more people on the street. We changed our programming to deliver hot meals to seniors and grocery vouchers to families. We had to stand up in our park system, childcare centers for our frontline workers. So we had to move a whole range of things. But we also saw that it became a Hunger Games between cities and states fighting for the limited resources to fight this virus because there was no national leadership. In Seattle, we were very fortunate to tap into the great, vast network of really smart people, great scientists, great tech people, and mostly a really great resident base where people stepped up and did what they needed to do to fight this virus, even though it was hard on them personally. A couple examples of what we had to face as a city, because we lacked testing. Through another forum that I was on and a relationship I had with a mayor in South Korea, Seattle was able to get testing supplies. So now we have been able to stand up free testing for Seattle residents and account for almost 15% of 12 to 15% of the testing statewide. This has helped us to go from one of the first in looking at almost 70,000 people could have been infected and a trajectory like Italy's or New York's at the time, to now we have one of the lowest COVID-19 rates of any major city in the country. We're wearing masks. People they don't think it makes them look weak like our president does. They know it shows. They care for themselves, their neighbors, and their friends. We are testing people, and we are still staying at home and taking smart measures around our businesses to keep people safe. So we will continue to work together as a city. Mayors are working together across this country to learn best lessons from each other, to see what's working, to help each other, and to write the playbook as we go. We are in this together, not just in America, but across the country. And that has, I think, built a sense of unity that we know that to get through this, we've got to be smart.
Right, right. Now, I'd like to pick you up on the point about the Hunger Games, because one of the really ugly things that happened initially was this degree to which there was a vicious competition unleashed between the states and the cities, and sometimes almost encouraged for PPE and other resources. In your views, maybe I'll start with Mayor Suarez on this. What could and should have been done to avoid that? And what does that suggest about how states should interact with federal government going forward?
Well, like Mayor Peduto, we identified this threat early, probably in late January, early February, and we ordered PPE equipment quickly as well, which allowed us to be stocked up. One of the areas where there was an enormous Hunger Games like attitude, where Mayor Durden was talking about, is particularly when it came to the CARES Act funding. If you were not a city that had a population, according to the census, of over 500,000 or more, you did not get a direct payment from the federal government for the CARES Act. So, for example, a city like Atlanta, my good friend Keisha Lance Bottoms is the mayor. They had a population adjusted at 506,000. They got $88 million from the CARES Act, which was critical to helping do a lot of the things that Mayor Durden was talking about in terms of helping your small businesses from going bankrupt, feeding people, creating, helping people pay their rent, helping people pay their mortgage, et cetera. The city of Miami got $0 from the CARES Act, $0. And we're a city that had a $20 million surplus going into COVID. We ended the year with a $25 million deficit. So we had to pay that deficit out of our reserves. And we started the new fiscal year, which began October 1st, with a $33 million deficit. So we were actually looking at the possibility of having to let go of police officers and firefighters, those who were on the front lines, who were taking the most risk in this COVID fight to protect our citizens and our residents. And so I think that was a major mistake in the rush to get all that money out. There was not a thought to allow cities that were slightly below, or all the cities that were below, which is the vast majority of them, of 500,000 in population. There's only 30 plus cities in America that met that threshold. So almost all the cities got cut out. Counties did not have a requirement to share the money with cities. States didn't have a requirement to share the monies with cities. And so cities got completely left out for some reason. And the cities are the ones that are closest to the people. We are the entities that are able to get that money to those people in the quickest, most efficient, and the best way to help them. And so it was incredibly frustrating. I'm hoping that in whatever CARES Act or HERO funding or whatever it gets called in the next round of funding from Congress, they fix that mistake. They give it they apportion it based on a CDBG formula, like we receive CDBG, Community Development Block Grant funds from the federal government. And also they allow us as cities to use the funds for what they call revenue shortfalls. Because again, it's no fault of our residents or our employees that this happened, and they shouldn't be the ones that have to suffer the consequences of it.
Right. What about, I think the point you make about the cutoff is very striking, and also, if nothing else, shows the importance of the census, which of course is another story we could all talk about. But Mayor Peduto, did you get the CARES Act funding? And what lessons do you learn about the scramble for resources?
Well, I couldn't agree more strongly with Mayor Suarez. I think people don't realize, or maybe they don't take the time to think about it, but the way that cities are financed is very different than states or even counties. We rely upon different types of sources of revenue, whether it's an amusement tax with our major sports teams and entertainment, or a parking tax, or other types of revenue sources that don't have a built-in resiliency to a pandemic. So unlike in Pennsylvania, where income is based not only upon what you earn in your paycheck, but also the dividends you're earning in the market, The city of Pittsburgh can only tax on your paycheck. And as you see people becoming unemployed, we're losing those resources, but the state's still receiving it off of the windfall of Wall Street. So what we realized very early on is we don't have a resilient system in order to be able to provide revenue during a pandemic. And like Miami, we are facing a $75 million deficit as I prepare my budget for the upcoming year. Our budget begins on January 1st, and I am in a situation where I have spent down our reserve funds. I have frozen any new hiring and laid off people through attrition, and we have cut every single dime and nickel that we could possibly do. But we're still facing a $75 million deficit out of a $600 million budget. And this is why we have a federal government. At those times when we need to help each other, whether it is through a flood or a hurricane or terrible fires, we're there for one another in order to be able to help us. Cities across the United States this year alone are facing over $360 billion in lost revenue. And the CARES Act money that came to the states has not trickled down to the cities where the services are the most critical. And just as Mayor Suarez said, what this will mean is at the time that we need emergency personnel the most, we will be forced, because of inaction in Washington, to lay off police officers, to lay off firefighters, and to lay off medics. Until Washington understands that they do have a role in not providing a handout, but allowing the opportunity for cities to be able to survive these next 2 years, that the inaction that they are taking will not only slow, but it will stop economic recovery from happening in this country.
Well, that is pretty terrifying. And I should say, by the way, if anyone's watching and listening and feels like me, pretty somber and wants to ask more questions about this, do please go ahead. And I'm going to pick up the questions in just a moment because we've got some questions coming through already. But I'm curious, what do you think is going to happen if this does not get addressed? And do you have any confidence that after the current election, the situation may become a bit better? Perhaps I can start by asking Seattle, because in some ways Seattle is in a much better position given your strong local corporate networks and your reasonably strong local tax base.
You know, Seattle is in a strong position in one regard, and I have to apologize to my friends, the mayors, because Seattle early on, because we were one of the first in COVID, I saw and recognized the economic harm it was going to be doing. And we lobbied very hard to get direct funding from Congress as CARES Act was going through. So we were one of the cities that was able to do so. But just like the other cities, our revenues have been decimated. I had to readjust our 2020 budget. We had about a $300 million hole we had to make up, and the same for next year. So local revenues have been decimated across America. If Washington doesn't act, I think you will see not just a stalling of any chance of an economic recovery, but I think we could really dip down into possibly facing depression area things again. The number of people unemployed in Seattle is at a record number. The number of people who could be losing their homes and because they can't pay their rent is at a record number. So if Congress doesn't act, they are deciding they don't believe in America. We need Washington to act. And I want to go back to your other question about the Hunger Games, because you asked what tools we had in place. The federal government has strong tools to make sure that we can harness the great innovation and genius of the American system of innovation and manufacturing and make sure that we respond to crises. We did it in World War II. We've done it other times in our history. We failed to do it in COVID. And if we don't do it, and if we haven't learned the lessons from the last failures of COVID, we may end up in the same as vaccinations come. Because every city in America will be looking for vaccinations at the same time, because until there is either a vaccination or effective treatments, we will remain in these limited COVID shutdowns and isolated from each other. But we're not just competing with each other. The whole globe will be coming out of COVID at the same time. And we already know there could be critical shortages of the ability to manufacture and transport enough vaccine for countries across the world, let alone cities across America. The Washington right now today isn't planning for that. We have not yet harnessed our manufacturing capability and our ability to get vaccines to people, let alone to make sure that people get those. And so I'm very fearful that if we don't learn the lessons from the past as a nation, again, you're going to see state versus state, city versus city, really scrambling to be the ones who can get the vaccinations for the residents in their city so the businesses and workers can thrive.
Right. Well, in fact, it's great you said that, because in fact, we get a question from John Slocum, which basically ties into this very nicely, which is, what is the responsibility of national with respect to vaccination? Maybe I can ask that to Mayor Peduto, and then Mayor Suarez and Mayor Durkan.
Sure. You cut out just a little bit as you were asking the question on my end, but what is the...
What is the responsibility of national government?
Okay.
Can you hear me now? Sorry. The question is, what is the responsibility of national government with respect to vaccination?
Yeah. The coordination of the distribution is the primary responsibility of the federal government. When we think about this, we have to start thinking like 2 steps ahead. You know, you simply can't put these vaccinations on a truck and ship it to where it needs to go. They need to be in a cold atmosphere, which means we need refrigerated transportation in order to be able to ship. We don't have enough trucks in this country to be able to distribute right now. And that's just one little part of the logistical steps that will be needed in order to be able to coordinate a mass national program, let alone a global program. The production of the vaccination itself and the locations of where they need to be so that the vaccination will remain able to treat the pandemic. You can't just have one distribution center for an entire nation and one production center as well. And so all of these different logistics of what is going to be needed in the next 6 months, if there is any conversation happening out of Washington, it is not coming down to the local level. And my worry is that they're not even considering it, but what they're thinking is the market will be able to handle it. Just like we saw on the supply side and the chains of manufacturing break down during this past year on everything from prescriptions to electronics to basically anything that is made. We do not have that chain in place in this country to be able to provide a mass distribution of a vaccine. And the federal government's responsibility is to coordinate the efforts between the states in order to do so.
Right. Mayor Durkan, do you want to comment on that, or shall I move to the next question?
No, I think that my friend has got it just right. And I'm very concerned because first there is, how do you get a safe vaccine? And I'm very worried that the political pressures that the president is placing on having a vaccine before it's safe will not only end up with not a safe vaccine, but people will be suspicious on whether they can trust it. Second, in America, we have about 3 different manufacturers who are slated to bring the vaccine online. Some require 2 shots, some require 1. And we don't have the capacity to either get it manufactured at scale or to distribute it, let alone to do that in a period of time that we can actually get people vaccinated, enough of them, to change how we're living. So I'm very concerned that we've not taken the steps, first, for the adequate testing, second, right now to be ready to manufacture it in a way that it can get to all Americans. Second, if you're a person that needs 2 shots, we've shown through other medical interventions that there is less likelihood that someone will go back for their 2nd shot. And if they don't, will they have the same immunity that they need? Do they know which shot they got so they know which 2nd shot to get? We also have things like a global worry that we will not have enough glass for the vaccination. And so the pressures on the manufacturing and systems itself have not been thought through. So I'm very concerned that we keep promising the hope of a vaccine to Americans, and that's when their lives can get back to normal. But the federal government, the only people who have the authority to make it happen and plan for it, aren't taking the steps they need now to make sure that that can happen.
Well, that's very concerning. I was very struck the other day because I was chatting to the former CEO of General Motors, who told me they ran out of elastic, the most basic product imaginable, when they were trying to make PPE, and discovered it was almost impossible to get enough basic elastic. They had to sort of improvise with something out of a car door instead. And you look at that and you think about how, as you say, how can you find the glass for the vaccines? How can you find all the parts, which people are relying so much on? Okay, a couple of other questions we've got. A question from Gabriel Sade via YouTube, which is, a city that relies heavily on sales tax and income tax are much more vulnerable. How can a city become more resilient looking forward, other than relying on sales tax and income taxes? Maybe that should be one for Mayor Suarez.
So in our case, we don't rely on income tax at all. So I think that's one of the ways to be more resilient. We don't impose any tax on income. We do have a sales tax, and that sales tax obviously this year was obliterated. We do have other fees, as Mayor Peduto said in Pittsburgh. We have parking revenue, we have franchise fees, we have a variety of other revenue sources, building fees, et cetera, that we generate revenue from. So we're not exclusively sales tax based, but we also do, and by the way, the sales tax that we receive is not direct, it's a pass through from the state. 45% of the largest revenue category that we have is property tax revenue. And so the good thing about property tax revenue is, for example, in a year like this year, part of the reason why maybe our deficit is not as bad as Pittsburgh is because a big portion of our taxes come from property taxes that are set beginning January 1st. So essentially, our values were locked in January 1st of this year for tax revenue that we receive in November of this year. So that's the way it's structured for us. Where we're going to take a hit is next year in terms of property taxes, potentially. And I say potentially because despite the COVID crisis, the real estate in Miami has continued to grow in terms of sales, in terms of value. We still continue to attract people from other parts of the country, particularly from the New York area as one of the particular areas. So it's possible that our deficit, and we're hoping obviously that sales tax revenue increases, parking revenue increases as the economy is able to safely open. And then we're hoping that the hit that we may have potentially seen on the real estate property side is not as dramatic because we're living in a sort of a time where it's somewhat of an anomalous time where despite this global pandemic, it appears that our real estate market continues to be strong. And so that's something that we've just been very fortunate. We've tried to maintain our city safe. We've tried to maintain our taxes low. But yeah, one of the ways to diversify is of course to have different kind of taxing sources.
I know whether either Mayor Durkan or Mayor Peduto want to jump in there, but if not, I have another question. Either of you want to comment on how you diversify your revenue base?
I would just add one other thing. Cities are the home to the institutions that provide service to an entire region. So a lot of city property is either non-taxable or nonprofit and tax exempt. In the city of Pittsburgh, it's 45% of our entire city is non-taxable. And that's 7 universities, a dozen hospitals, and other large institutions. And it may have made sense when nuns ran hospitals in the 1890s when the laws were passed in Pennsylvania, but it really doesn't make sense today. If we are going to have a resilient revenue strategy, it will require that everybody pays their share.
Right. So we have a very interesting question here, which is, in both Pittsburgh and Miami, NFL teams are allowed to have fans in stadiums, which could be considered a large public health risk. How do you balance these high revenue and extremely popular industries with protecting residents? Mayor Suarez or Mayor Boulton, would either of you like to comment on that?
Sure. So in the case of Miami and the Dolphins, 2 things. One is the governor did allow a stadium to be at capacity, and the Dolphins, to their credit, have done 2 things. The first is they spent millions of dollars making the stadium as touchless as possible and trying to make the stadium as COVID compliant as possible. They probably set the standard in the NFL, though the Seattle Seahawks and the Pittsburgh Pirates the Pittsburgh Steelers may think otherwise. But the second thing is they actually decided not to take advantage of the ability that the governor gave them to go to a full stadium. So in Miami, at least in the short term, at least for this weekend, they're going to be at 13,000 as opposed to the 65,000 that they could be at a full stadium. So they have actually decided themselves that despite the obvious revenue increase that they would generate from being at 65,000, it's more than 3 times, 4 times what they're currently doing. They're going to stay at that 13,000 because what we've seen throughout sports is, you could be at 65,000 for 1 week, but if you have a super spreading event and you have 10, 15, 20, 30, 40, 50, 100,000 people that get sick, that's going to destroy your brand. You're going to have to shut the season down. So I think they've taken the prudent route. I don't know how long they'll stay at the 13,000, but I can tell you that I'm very proud of the fact that they have remained disciplined and decided to wait a little longer and see how things work out.
Yeah, I would just add in Pennsylvania, the governor has allowed 5,500 fans within Heinz Field for both Pitt Panther football and the Steelers football. We've only had 1 game so far. It seems that the Steelers were able to do the job that was required. We are watching places like Miami and other cities that have been doing this for a few weeks longer and just trying to learn any lessons possible. I will say this, though, and it's something that people need to be cognizant of. We're just entering into the COVID season, and the COVID, the virus itself has a time of year that it is producing, and that is from late October through late February. And we're going to see a spike around this country in the next couple of weeks. And the question is whether that spike will exceed what we saw back in March and April. There's a chance that it will. So any of these rules that are being put into place regarding crowds or any type of place where people gather could very well change dramatically over the course of the next couple of months.
So, Jillian, I think I'm maybe the minority.
Jump in, or should I go to the next question?
Yeah, no, I'd like to jump in a little bit.
What,
Look, I know I'm the minority. I know. Can you hear me?
Yeah.
Yep. So I think I'm a minority among my mayors here. We do not have people going into our stadiums live, and that's because the science, we think, is clear. The gatherings are what spread this virus, and we are still in the middle of a very contagious, very deadly pandemic. it has been hard because our Seahawks and our fans love each other. But they've done what's right. They've protected the team. They've protected the fans. We're 5-0, so it's working. And I just think that, we can't, we need to have as much normality as possible, but we've got to respect the actual science. And the science says if you bring people together in close proximity for long periods of times, you're going to spread the virus. And so I know it's an economic hardship on sports teams. It's hard on the colleges. But we've seen what happened, for example, in Boston, where the key quarterback got COVID. And that has decimated their team's ability to compete. We've seen the NFL scrambling to redo games. And so I really believe that we've got to, while we need a return to normality, and here in Seattle, we're doing all we can, for example, to help restaurants by providing outdoor space, because we know the disease spreads less in the outdoors and well-ventilated places as long as you take the other precautions. But I do think that as a country, it doesn't do any of us any good to pretend the science isn't what it is, which is it's a contagious disease. It's killed hundreds of thousands of Americans. Millions have gotten sick. We're about to see the period of time where we can have an uptick. Now's the time to be more careful, not less careful.
Right. Well, we have an interesting question here, which is, these past few months have been a moment of national reckoning and a time of dual pandemics, referring to both the coronavirus and racism. How has that affected urban governance? And we also have a question about how this has affected your concept of tackling equity issues and dealing with the most vulnerable. I'm curious, as you sit here now, what do you think you've learned about what it means to have been a mayor? And would you have taken on this job a year ago if you'd known what it was going to be turning into? Maybe I can start that with you, Bill, Mayor Barduto, because I think you've got the biggest grin.
Yeah, it's an interesting time to be a mayor, and I think my colleagues would agree. We're getting it from both the right and the left. No matter what it is that the decisions are being made, people are so polarized right now, but they are also very set in their ideas that what we have to do is do the job of being pragmatic in getting the job done. And I think in some ways what the public wants is a cheerleader for either side. Somebody once said to me, and I believe this, there's three political parties in America. There's Democrats, Republicans, and mayors. We don't get the opportunity to be philosophical or to try and just spread a theory. We have to pick up the garbage on Monday morning. And so when we're seeing in this crisis of both a global pandemic and a national emergency centered on racism, what we are dealing with are all of the side effects of both, of making sure that we're keeping our public safe and that we're doing everything we can to lessen the impact of a pandemic, in trying to build more equitable policies, programs, and projects throughout our cities in order to lessen the real issues of racism. I think what makes the job difficult is when both of those issues become politicized, and when you're not dealing directly with those that are the most affected by both a pandemic or by systemic racism, but you have spokespeople who have their own agenda, who try to push that agenda into that narrative. And being able to take on all of that is the job of a mayor. And I can't speak for my colleagues, but I would say unequivocally, if I would have known all of this would have happened last year, hell yeah, I would have said I want to be a mayor. And that's what you sign up for.
Well, you're going to have, I hope you're all keeping great memoirs, by the way, or diaries, because I think that, some of these diaries at the front line of the decision making, would be absolutely fascinating. And unfortunately, what tends to happen after a national crisis is that it's a federal government that gets, the diary keeping, the memoir keeping spotlight. I think what you guys are doing at the front lines is probably absolutely as fascinating, if not more fascinating and more real. But Mayor Suarez, what about you? What have you feel like you've learned in the last year about governance? Because, you have had such an interesting position, quite apart from the fact you had COVID first. You have been in the spotlight because of the very febrile politics that are swirling around Florida. And it's going to play into the next election as well. So I'm kind of curious, what you think you have learned or what you hope to learn for the future.
Well, I think the first thing is it's good to know that the next 3 weeks are going to be very boring, right? There's not going to be anything interesting happening over the next 3 weeks. No, listen, I can't agree more with Mayor Peduto. And in fact, I'm going to use his line because I think that's a great line of the three political parties in America, Republicans, Democrats, and mayors. I always used to say that if I had to create a political party, it would be called the Solutions Party. And I think, I think that quote from Mayor Peduto really exemplifies that. The mayors are about solving problems. And I think that brand has been elevated throughout these crises because we've been required and forced to solve these problems. A lot of the decision-making has been pushed down from the federal level to the state level down to mayors. And so a lot of mayors have had to make these tough decisions. We've had to create our own set of experts, epidemiologists, biostatisticians. It wasn't until recently that I started getting calls from the coronavirus task force on a weekly basis. And now I'm having direct conversations myself with Dr. Birx, Dr. Fauci, Dr. Redfield, and Dr. Adams, the Surgeon General. So, when there's a leadership vacuum, mayors have been the ones that have been stepping into that vacuum. And that has given us a national and international profile, which I think has been refreshing. And I don't think it's an accident that in the last presidential election, on the Democratic side, there were multiple candidates that were former mayors. Pete Buttigieg, Cory Booker, Julian Castro, major candidates that went very far in the nominating process that were former mayors. I think that's here to stay, frankly. I do think you're going to see more mayors, particularly in the world that we live in today, where it's, where there's a ubiquity to the ability to be able to communicate on laptops and on computers and on obviously on Zoom and on Skype. You're going to see mayors more at the forefront. And I think people really like to see the no nonsense, nonpartisan, oftentimes, these mayors, the ones that are on the call and many others have become my personal friends. We lean on each other. We talk to each other constantly about best practices. And oftentimes we have no idea what political party we come from. Or, there have been people that have known me for months and said, I just realized that you were a Republican. And so, I think the reason why is because we speak direct, we speak to the issues. We don't get caught up in a lot of the partisan politics. And we don't really have that luxury, frankly.
How often, I'm very curious actually, I'd love to ask a question to Mayor Durkan as well, because I often think that you guys are acting a bit like you've got a sort of self-help group, if you like, and you probably all need to sort of band together at times like this, and both swap ideas, but also overcome the Hunger Games. If you can turn Hunger Games into Kumbaya, I think you're doing something that most Americans will applaud you for. But Mayor Durkan, I'd like to ask you what your thoughts are on this.
So I agree with my two mayors. I think that mayors across America really have been at the front lines, and we've created the playbook on COVID. And we take advantage of what we've learned from each other and trying to figure out how do we balance all these interests? How do we, like Mayor Peduto says, pick up the garbage on Monday, but then also address what we're seeing in the streets across America, the uprising on civil rights and a racial reckoning, to know that when we come back from COVID, we can't just come back the same. We have to come back better and more equitable. And we're having to address this real inequities that we saw. When I came in as mayor of Seattle, I could see the deep inequities that were being built into the systems because the innovation and technology economy was building prosperity for some, but others were getting left behind. And COVID has only accelerated that. And it's been our communities of color that have suffered most under the health impacts of COVID. The disparities are really quite shocking here in Washington state. Even with our low numbers, our African American and Latinx communities are disproportionately hit. Same is true with the economic hits. It's hitting our communities of color. So while we're looking at these issues of race in America around policing and other institutions, one of the things I did in my budget was we know we have to deeply invest in those communities of color to make up for the under-resourcing and the systemic racism of the past. So even with almost a $300 million shortfall, I created a $100 million fund for investment in our Black, Indigenous, and communities of color communities, driven by a community process. So they could identify community-based solutions and where those investments need to be made to really build true resiliency and true community safety. And I think you're seeing those kinds of actions by mayors across the country. If and when we get through COVID, every good thing coming out of this, literally, I think, is because of mayors. They have been the closest to the people. They're the ones getting the solutions and driving solutions. We're talking and learning from mistakes and building on successes. So I'm really thankful to have the mayors I have as my friends across the country.
Well, all I can say is it's a pity that the mayors aren't on the ticket for next month. And we are obviously preaching to the converted, but I do think that many Americans would feel that Washington was doing a much better job today if it was acting like a gigantic mayordom. But anyway, sadly, you all have to go off and do your real jobs now, although I do hope you're keeping a good diary. I'd like to say thank you to you from the bottom of my heart, both for exposing the somewhat terrifying challenges that are coming down the tracks. And I think what you say about the risk of depression, the fiscal challenges, the nightmarish challenge getting out the vaccination, the issues of equity is very, very sobering indeed. And yet I think I speak for everyone watching to say what is perhaps most encouraging is that not only are you committed to trying to find practical solutions, you're committed to talking to each other, whatever party you come from, and essentially being civil, decent, and doing everything you can to build that all-important ingredient for recovery, which is trust. So thank you, good luck, get back to your day jobs, and I think we all wish you the very best of luck and stay safe.
Thanks, you too.
Thank you, Jillian, and Mayors Durkan, Peduto, and Suarez. We're a nonpartisan organization, but I can say that after this, we'll all be hoping that there is a mayor's party soon. As we close today's program, let's look at your opinions from the live polls. Our first question was about how confident you are in your local mayor's ability to respond to COVID-19. And here are the results. Very confident, 45%, semi-confident, 52%. That's 97% showing some confidence in the ability of mayors to respond to the COVID-19 pandemic. That's great. Our second question was about the likelihood of the pandemic will affect your choice to live in an urban area. And let's see the responses here. Interestingly enough, 60% of you said no change in how you feel about it, but by a 4-to-1 margin, people would like to go to rural or suburban areas as opposed to being more likely to live in an urban area. Not surprising, but interesting results nevertheless. The last few months have been a powerful testament to the key role that global cities, city networks, and mayors play as they lead the on-the-ground response to the COVID-19 challenge. The solidarity established and reinforced between cities to build back better together is indeed commendable. We will continue to explore these issues and more, and we will provide a place for conversations on the role of cities in moving through a global pandemic, an economic recovery, and addressing issues of social justice. Our work on adapting governance will continue through the end of the year, when we will pivot to pursuing equity and then to reimagining resilience. Our next live stream program on pursuing equity will be on February 11th. Visit globalcitiesforum.org to register and be sure to check back regularly for updates. And while you're there, sign up for our monthly newsletter. Thank you to today's speakers and moderators, our sponsors, and to everyone who spent the last 2 hours with us. We know you have a lot of choices for your engagement, especially in the digital age, and your support is what makes our work possible. Please stay safe. We hope to see you soon. Thank you and goodbye.